Hi friends, welcome to the channel. The Nurse. Here we are discussing about community health nursing and current affairs multiple choice questions that will be helpful for preparing AIIMS NORCET and JIPMER Nursing Officer Exams. So before going to our topic, if you are not subscribed to our channel, please subscribe and we will upload more videos in coming days. So we will go to our topic: community health nursing and current affairs multiple choice questions and answers. First question: clinical features of the botulism are all except diarrhea, ocular nerve paralysis, dysarthria, blurring of vision. Botulism is caused by Clostridium botulinum bacteria. Usually, it is spread through closed that bottled foods. So, the Clostridium botulinum bacteria will produce an endotoxin that will cause this disease. So, here correct answer is diarrhea. Diarrhea is not a common feature of botulism. The mainly botulism will affect the nerves. So the main symptoms includes ocular nerve paralysis, dysarthria, blurring of visions. Botulism is a rare and potentially fatal illness caused by endotoxin produced by bacterium Clostridium botulinum. The disease begins with weakness, blurred vision, feeling tired, and trouble speaking because it is causing our nervous system. So it will the first symptoms will be a weakness, blurred vision problem will be there, feeling of tiredness, trouble in speaking. These are the initial symptoms of botulism. Next question: following are human deadened disease except bubonic plague, Japanese encephalitis, leishmaniasis, hydatid disease. Human deadened disease means the zoonotic disease that is spread into humans. Then humans will be the last person. It will not transmit to other animals. That is why it is known as human deadened diseases. Humans are deadened host for these diseases. So here correct answer means leishmaniasis. Bubonic plague, it is caused by Yersinia pestis and it can spread through infected fleas. Japanese encephalitis also, it is transmitted through mosquitoes. And after getting humans, it will not transmit to other animals. But leishmaniasis will transmit to humans. Then again, one part of the life cycle will complete at the humans inside the human. Then again, after bite of sandfly, it will the blood and the infected organism will enter into a sandfly. Then half of the life cycle will complete in sandfly's body. Then again, the bite of that infected sandflies will cause infections. So in leishmaniasis, the cycle will continues. Human to sandfly to animals or humans. But human deadened disease means after getting humans, it will not transmit to other animals. That means the deadened host is human, a host from which infectious agents are not transmitted to other susceptible host. That is why humans are known to deadened disease for that bubonic plague, hydatid disease, etc. Third question: patients are to be isolated in all of the following diseases except AIDS, smallpox, anthrax, plague. Usually, isolation is required in the case of the transmission is mainly through droplet or airborne transmission. In the case of AIDS, there is no need for isolation. AIDS usually transmitted through the infected bloods or blood transfusion or sexual intercourse, unprotected sexual intercourse. So in the case of smallpox is direct transmission directly due to the direct contact or droplet transmission. Anthrax also, the infected the spores of the bacteria will transmit either through the droplet or it can be transmitted through the injured wounds. Plague also have multiple way of transmission. The plague will the infected bacteria will transmit through the rodents or the droplet infection through also it will transmit. And if any wound injury is there on the legs and all, the infected secretions of the infected secretions, if it is entered through that wound, also a way of route of entry for plague. So these are the main transmission of smallpox, anthrax, plague. This diseases required isolations, but in the case of AIDS, there is no isolation required because the mainly transmission of AIDS due to unprotected sexual intercourse or through blood transfusion. Fourth question, tick-borne disease is, or example for tick-borne disease: tularemia, Q fever, dengue fever, malaria. The disease carried by tick, that is known as tick-borne disease. The example for tick-borne disease is tularemia. Tularemia means it is a rare infectious disease. It is also known as rabbit fever or deer fly fever. Tularemia is a rare infectious disease that is also known as rabbit fever or deer fly fever. It typically attacks skin, eyes, lymph nodes and lungs. Tularemia is caused by a bacteria that is known as Francisella tularensis. The bacteria name is Francisella tularensis. The disease mainly affects rabbits, hares and rodents such as muskrats and squirrels. So tularemia is an example for tick-borne disease. Ticks can be infected with bacteria, viruses or parasites, and it will transmit the infection to the humans. The common tick-borne diseases are Lyme disease, babesiosis, ehrlichiosis, Rocky Mountain spotted fever, anaplasmosis, southern tick-associated rash illness, tick-borne relapsing fever, and tularemia. Fifth question, Yos is a disease caused by. Yos is a disease caused by Treponema pertineu, Treponema pallidum, Treponema caratium, Trypanosome cruzi. Yos is caused by Treponema pertineu. Treponema pertineu is a subspecies of Treponema group, and it is it causes Yos disease. Yos is a chronic skin infection characterized by papillomas. Papillomas means small non-cancerous lumps that is appears on the skin, and it will also cause ulcers on the skin. It is a chronic skin infection. The Yos, the causative organism for Yos, that is bacterium Treponema pallidum subspecies pertineu. Treponema pertineu. Treponema that is belongs to same group of bacteria that causes venereal syphilis. Treponema pallidum, that is a causative agent for syphilis. But Yos is caused by Treponema pertineu. So don't confuse Treponema pertineu, Yos, Treponema pallidum, syphilis. Sixth question, modifiable risk factor of hypertension is ethnicity, age, sex, obesity. Correct answer, obesity. Modifiable risk factor of hypertension is obesity. Risk factor means risk factors are conditions that increase your risk for developing a disease. Risk factors are conditions that increase your risk of developing a disease. These risk factors divided into two types: modifiable and non-modifiable risk factors. Risk factors are either modifiable, that is, you can take measures to change that risk factor. Modifiable risk factors you can change. The same time, non-modifiable means you cannot change the risk factor. That kind of risk factors are known as non-modifiable risk factors. Examples of non-modifiable risk factors includes age, sex, ethnicity are the examples of non-modifiable risk factors. Modifiable risk factors includes obesity. We can take measures to reduce obesity by reducing the changing the diet pattern, or you can also do exercise. These are the ways to change the modifiable risk factors. Next question, JIPMER Mission Mode project is on community control of. JIPMER Mission Mode project is on community control of cancers, hypertension, coronary artery disease, rheumatic fever. Correct answer is rheumatic fever. JVCAN Mission Mode project is on community control of rheumatic fever. That is project introduced by Government of India. Eighth question. A nurse is removing dangers of the unconscious patient while giving oral care. Then she has to wear sterile gloves, wear clean gloves, remove without gloves, remove with dental forceps. Correct answer is wear clean gloves, because removing danger plates is a clean procedures and sterile gloves are not required. Ninth question. The client has slept little over the past 24 hours. Which assessment finding is consistent with sleep deprivation? Period of apnea lasting greater than 5 seconds, slowing of thought process, hyperventilation, cool extremities. Correct answer is slowing of thought process. Client who becomes sleep deprived often shows signs of impaired cognitive functioning. The other assessment findings are not associated with sleep deprivation. So, if there is sleep deprivation means there will be impairment in the cognitive functioning. So, that represented by slowing of thought process. 10th question. A 33-year-old client reports left leg pain, right-sided chest pain and sudden onset of shortness of breath. Which action should be taken immediately by the nurse? Take the client's temperature, auscultate the client's lung sound, percuss the client's abdomen, request a stat chest X-ray. Here, correct answer is auscultate the client's lung sound, because it will be the immediate nurse's action. The nurse should find out the cause for this shortness of breath. He is having right-sided chest pain and shortness of breath along with left-sided leg pain. So in that condition, the nurse will auscultate and she can assess the bilateral air entry, if there any blockage or any difference is there in bilateral air entry. So she can find out the cause. Auscultation of the lung sound should be one of the first assessment performed by the nurse to determine the cause of client's shortness of breath. Chest X-ray would be helpful in assessing cause of shortness of breath, but would need a physician's order and would not be the first priority. Percussion of abdomen and measurement of client's temperature are helpful tools when completing a full assessment, but are not priority in these situations, because shortness of breath is an emergency condition. It requires immediate assessment and care. So that's about that question. Next question from general awareness. What is the meaning of white solid lines marked on the Indian roads? Overtake or cross safely, don't cross the lines, pedestrian ahead, stop here. So correct answer is don't cross the lines. White solid, continuous white solid line means don't cross the lines or don't overtake that vehicle. Because white solid line means it will mark where accidents are more prone. So in that area we should not cross the lines or we should not overtake. If there is dotted white lines means you can cross or overtake the vehicles safely. You need to check the situation is safe, then you can overtake if there is white dotted line. But if continuous white solid lines means you should not cross the lines. Next question. To open a trading account in Indian stock market, you should have. To open a trading account in Indian stock market, you should have savings account, current account, demat account, fixed account. Correct answer is demat account. Next question. In India, to adopt a child up to 4 years, the maximum age limit of one of the parent. 90 years, 45 years, 55 years, 35 years. To adopt a child up to 4 years, the maximum age limit of a parent is 45 years. One parent should be 45 years. So, and the total the age of the both parent should not be exceed more than 90 years. 14th question. The total number of medals won by India in Commonwealth Games 2022. 20, 35, 61, 88. Correct answer is 61 medals. India won total of 61 medals at the Commonwealth Games 2022 in Birmingham. India finished 4th on the medal tally with 22 gold, 16 silver and 23 bronze medals. Next question. The Commonwealth Games 2022 was held in India, England, France, Japan. The correct answer is England. The 2022 Commonwealth Games were held in Birmingham, England. Which of the following country has administered maximum number of COVID-19 vaccination till date? India, China, United States, Indonesia. Correct answer is China. Data as on 16th August 2022, China has administered 343 crore COVID-19 vaccine. India is second, that is 208 crore COVID vaccines administered. United States is in third in the case of number of COVID vaccination administration, that is 60.6 crore vaccination they have administered. Fourth, that is Brazil. Brazil administered 46.7 crore vaccination. 17th question. At present in India, how many airbags are mandatory in cars? At present in India, how many airbags are mandatory in cars? 1, 6, 2, 4. Correct answer is 2 airbags should be there in cars. Now, Government of India is planning to put 6 airbags, but the law is not yet implemented. The planning is started. Currently, 2 airbags should be there in each car. Then 18th question. India's first underwater metro will be inaugurated in which city? Bangalore, Kolkata, Hyderabad, Mumbai. Correct answer is Kolkata. India's first underwater metro will be inaugurated in Kolkata, West Bengal, and the project is likely to be completed by June 2023. The metro line, which will connect Salt Lake to Howrah by Kolkata with a stretch below the Hooghly River, is currently operational between Sector 5 and Sealdah stations. The underwater metro will be the work will be completed on June 2023, and the metro is planned will connect Salt Lake to Howrah via Kolkata. It is under the Hooghly River. 19th question. To celebrate 75th anniversary of Independence Day of India, the central government launched Har Ghar Tiranga, Azadi Ka Amrit Mahotsav, Jai Jawan Jai Kisan, Jio Bharat. Correct answer is Azadi Ka Amrit Mahotsav. Azadi Ka Amrit Mahotsav is the name of the project that the Government of India launched to celebrate 75th anniversary of Independence Day. As a part of Azadi Ka Amrit Mahotsav, the Prime Minister of India announced Har Ghar Tiranga. Every house has to keep a Indian flag on the occasion of 76th Independence Day. Last question. Pradhan Mantri Jan Arogya Yojana or PMJAY, popularly known as Arogya Bharat, Ayushman Bharat, Insurance for All, Garibon Ka Arogya Yojana. Correct answer is Ayushman Bharat. So that is about today's video. So if you have any doubt, means you can ask in comment section, and you can also share with your friends, and please like this video, and thank you for watching this video. Bye bye.